Go ahead. Yeah, okay. Hello everyone, this is Braswell Dean, Department of Family Medicine. We're going to be doing an injection today, and it looks like initially when we were doing this, I thought this was going to be a greater trochanteric bursitis type of thing, but it looks like the painful site really is over on the sacroiliac area. And sometimes we'll do injections up in the lower lumbar area, like with trigger point injections, but a little bit lower. Often patients will come in with this painful area. So what we're going to do, obviously the technique will be the same whether we're injecting an area up in here or up over here or down in here. So the first thing usually I'll do is clean this site, and I'll usually put the alcohol here rather than doing a rub here. This style I like because it keeps the area maximally clean. Another thing that I'll do is I'll just put the alcohol in my left hand if I'm using my right hand, because it gives me something to bring out really fast, especially if I'm working by myself. So we're going to be, now there's different ways to do this. Different doctors will have different styles. One thing that I like to do is I'll put the area, and we've marked the area with just a small pin like this to leave a dimple on the skin, so we don't make a mark on the skin, because that usually gets rubbed off with the alcohol. So what we're going to do is we're going to put a little amount of lidocaine underneath the skin in a way that will make the whole area numb from the very beginning. So using my hands working together, and I like to hold the skin tense so it doesn't hurt. So we'll inject on 3. 1, 2, 3. That's it. And we inject the lidocaine as slowly as we can. And then and only then, after a good cc has gone in, then I can actually move the needle a little bit so that we can make everything nice and numb. I try to use all 3 cc's. Okay, and so the second part of the procedure is coming up, and basically I'll do a massage of the lidocaine so that all the medicine gets worked into the area. For our second part of this injection, this is 40 milligrams of triamcinolone, which is Kenalog, aka Kenalog, but 40 milligrams of triamcinolone, plus I mix a couple extra cc's of lidocaine as well with this. And now we'll just inject straight in. And that should do that. So again, this triamcinolone will kick in about 3 days. It will work around the clock and should provide relief for 3 months. Sometimes patients get a little bit more relief than 3 months, but that's a good rule of thumb. So a very easy little procedure to do, and in many times provides a tremendous amount of pain relief for this type of problem.